afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Tuesday, June 21st, 2022, and we're back to do a COVID update. You know, people are asking me, I received some texts today that they saw posts go out that we're going to do an update about what's going on and what's wrong. And it's really not, anything's wrong. But what we wanted to do is there's been some increases in the last few weeks, and there's some rumors out there. You're starting to see some things on social media and the news that are true and not true, and just want to get that update and start that drumbeat a little bit to make sure we're all on the same page in the Northeast Texas community. Over the last few weeks, from a numbers perspective, we've seen more positives in Northeast Texas, and especially the 5 counties that represent the Titus regional area. You start to see a few more. Most of them, very few of them, been in the hospital, and most of the people in the hospital that we've seen are COVID non-related to their illness, and we've caught them in the emergency department or for surgery and some other things. But in our clinics for the last 2 weeks, we've started to see every day a few more, and then last week quite a few more, and this week a few more than that. So we're starting to see that increases. You normally used to put up numbers, but the COVID world's changed just a little bit, and with the amount of home tests that are out there and the ability to do tests at home, quite a few people are getting their positive tests at home and coming to the clinics already knowing they're positive. So they're just treated. So some of the numbers you're going to see at the state level and some of the numbers you're going to see reported in labs, it's not like it used to be, because those are home tests that are being done and not being, but they're still accurate, and they're still positives, and we're starting to see that increase. Had the opportunity with Patty Beckman and Kathy Griffiths last week to visit our friends in Richardson, Texas at the Methodist Health System, beautiful health system, kind of a like-minded health institution, and they have a commitment to excellence similar to Titus Regional Medical Center. So we visited them and we talked about COVID and some of the challenges that they've had in COVID and what they saw, and then what we saw during the last 2 years. And it was interesting to learn that that hospital located just off the toll road has kind of been different than the rest of Dallas. And they've been a leader in the Dallas area of COVID spikes for the last 2 years. And what we've noticed is we're usually 2 weeks behind the Dallas Metroplex. And in our discussions, we talked about for the last 2 weeks, they've been running hot. And on Friday, they had 22 hospitalized COVID patients in their hospital and 4 on vent. And last week, the Dallas area, exactly 2 weeks behind them, started seeing the increases in the Dallas area with COVID patients on vents. And if the numbers from 2 years ago and last year are consistent, over the next 14 to 17 days, we would start seeing more increases of our hospitalized patients. So we just wanted to get that out to the community and let you know. What we're seeing is what we saw before when we talked to them, heart and vascular patients that have heart and vascular disease, transplant patients, diabetes, high blood pressure, all the similarities to people that are getting on the vents. They have seen a trend of increased younger this time, of that 50 to 68-year-olds on vents over the last few weeks, what they're seeing. But with that increase in Richardson and then what we're seeing in the Dallas area, and what we've seen locally, we just wanted to have that conversation and encourage you as a community, as your friends and family, wear your mask when you're around people to the best of the ability, social distance to the best of the ability, wash your hands, go back, do the fist bump. We've been fist bumps for 2 years, side hugs, those things worked, and we still kept friends and be able to have relationships. But would encourage you to social distance to the best of your ability, but just be aware. If you start, most important thing that you can do in the new world that we live, if you start showing symptoms, you start feeling bad, stay home. Quarantine yourself, and kind of what we were reading from the CDC and Dr. Thurman and the team here at Titus, if you're test positive, it's 5 days of quarantine from the start of your symptoms, or testing positive with no symptoms. So 5 days quarantine, and then go 5 days with a mask. So you're 10 days, 5 days quarantine, 5 days mask. That's going to make you the best opportunity to minimize that spread to your families and your friends and the people around you in Northeast Texas. Would also continue to encourage you to vaccinate. If you did not receive your second booster or your booster shot, I would encourage you to get it as well. The majority of the vaccine, what we saw in the vent last week when we talked to our friends, none of their vent patients have had the booster shot. There were a couple situations where they had seen vented patients who had been vaccinated, but no situations it was a very sick patient other than the vaccine as well. So there's other things going on. But vaccinations continue to be one of the ways to mitigate how sick that you are. From a Titus perspective, we do not have any patients today in our health system, but we're seeing positives come through our emergency department and seeing the increase in our clinic. I would encourage you to vaccinate. Titus Regional does do vaccinations. We do them at the Family Care Center at Harts Bluff. We'll do them today, tomorrow, and Thursday of this week. Starting next week, vaccinations are on Monday and Wednesday. So Monday and Wednesday of each week. Check us out on our webpage and Facebook on which days we do vaccines 2 days a week at the Family Care Center, Harts Bluff. I would encourage you to go over there to get your first shot if you haven't, your second shot if you didn't get it, and get your booster shot if you have that as well. So just wanted to continue to encourage you to vaccinate, continue to encourage you to do the most we can to try and mitigate the spread. What is the availability and the results of the newer meds for COVID-19? Dr. Thurman and his team has the meds here at Titus, continuing to get the meds that we need. So they're constantly researching and doing everything that we can here locally. So there's not been an issue to this point of the medications. And Dr. Cannot remember the exact med that we talked about with him on Thursday of last week when we met about our COVID update with him. But they're constantly looking at and studies of the different medications, and he's working closely with our pharmacist, Ruth, to get those medications there, and they've not been a problem yet. Antibodies, we've started doing some infusions as well. So encourage you, if you are showing symptoms and you test positive, please contact your primary health physician. Want to get with your PCP and start talking about what you need to do. Again, want to catch you early. If we can get you the medicines that you can before you get sick, that is one of the things that we need to do in order to mitigate this spread. The other thing that I want to talk about today is just, in addition to COVID, wanted to switch gears a little bit and just make you aware and invite you, the community of Northeast Texas. Dr. Mark Kimball will be retiring at the end of June, and many of you know Dr. Kimball. Many of you you've seen them, your children have seen them, your grandchildren, and some of your great-grandchildren have seen Dr. Kimball, who's been in Titus County for over 30 years as part of the pediatric clinic. Great man, great physician. It's been an honor to have him, and we've been blessed to have him on our medical staff for 30 plus years. He has been just a rock and a stone for mentorship and really a generational changing person. If you look at the different generations that he is taking care of, kids, then their kids, and then their grandkids. So, Dr. Kimball will be retiring next week, and on June 30th, Thursday, in our lobby at 2 o'clock, we'll be doing a ceremony for him and just recognizing him and just thanking him. And we'll have some refreshments there. But please come at 2 o'clock next Thursday, June 30th, and express your gratitude, your appreciation for him serving Northeast Texas for the past 30 years. We'll start our updates next. We'll continue the updates, and next week if we see him, we'll do another COVID update, up or down. We'll let you know what we're seeing. We want to keep you informed as a community. I can't not end. This is summertime. I'm a big baseball guy with the College World Series. The good guys are playing right now, even though I'm working, so I'll have to watch it later. But got my Ags that are playing on the College World Series right now against the Catholics. So it's Cowboys versus the Catholics, I guess, going against Notre Dame. But want to gig them out to the Aggies, and last when I walked over here, the Ags were up. The good guys were up 5-0. So a little baseball in the air. So hopefully it continues. And want to wish everyone a happy 4th of July as we get ready for that season and start their holidays. But thank you for your service to this health system and your support of this health system. Again, we please encourage and appreciate your support in mitigating the spread of COVID in Northeast Texas. Thank you. God bless.